are significant benefits from breast screening. This is something that's been produced nationally, and it's really just a little key ring, but it does show the sizes of the lumps that can be picked up. There's tiny little lumps that you can see on the top of my thumb here. There's 4 little small balls. Each of those is the kind of size that can be picked up by regular breast screening. So really, size of really is an eye pencil, perhaps. The next one, the pink one here, is the size of a lump that can be detected through a one-off mammogram or X-ray of the breast. This next one, which is the size of a small marble, is about the size that your average your breast surgeon would pick up on your average woman, and remember that they are very skilled at examining breasts. And this last lump at the end, the biggest one, is about the size that a woman herself, on average, might be able to detect in her breasts. So you can clearly see there's a significant size difference between the smallest that's picked up by regular mammograms compared with what you can pick up yourself. Intuitively, that makes a difference, but also we've got confidence in the programme because this UK-wide review has shown that there's been a significant reduction in mortality from regular breast screening in terms of, you take part every time you're offered a test, then it significantly reduces your chances of dying from breast cancer. I think bowel screening is one of our first opportunities. Again, from an evidence base, it's equally important for men and women because bowel cancer affects men and women. It does allow us to pick up cancers at a very early stage, and where those are treated, we can get extremely good results for patients in terms of increasing their life expectancy. It's a lifesaver. For a variety of reasons, some people not keen to take the test, I think because they think of it as being messy potentially, and people don't want to talk about the bowel and that sort of thing. So we're trying bit by bit to sort of break down some of those taboos, and there's been campaigns like the Scottish Government campaign to detect cancer early, which had the man on the toilet and the invisible voice talking to him about had he taken the test. And I think what we would say, and we would encourage people very strongly to consider taking the test because it does have incredible benefits. And the cancers that we're picking up from bowel screening are really at the very earliest stage. And it makes such a difference to be able to pick them up through screening before they cause any problems at all, as opposed to picking them up when patients are symptomatic and they can be feeling really, really awful with the type of symptoms that they can get with the bowel cancer.